Hello everyone, welcome to Dr. Shefaly Shares. My name is Shefaly and I'm a nursing and midwifery professor from NUS Nursing. Today's the topic I'm going to cover in this video is about what are the different tracks or what are the different roles nurses can take, especially in Singapore. I feel this is a question which is most asked from me by upcoming nursing students or anybody, even if they have joined nursing, sometimes not really clear how nurses evolve in different roles, especially in Singapore. Before I give you an idea what happens in different tracks as far as nursing is concerned in Singapore, I also want to reiterate that many things I'm going to share, it actually apply globally. Nurses generally, they have varied roles to take, and we are in a very beautiful time where nursing has evolved and flourished over the years, and we have now established tracks which nurses can take. Let me bring you through these different tracks. First, nurses as clinicians. I think very well-known fact around nurses are that we provide our care and we take care of the patients in need when they are admitted or when they are going through sickness. Little bit of a change in that. Yes, it's 100% true that we are there to allay people's sickness, their signs and symptoms, and provide them the care when they are at the most vulnerable state of their life. However, things have changed now. Even as clinicians, we nurses, we don't really work in the acute care settings, for example, in the hospitals, taking care of the patients in the wards. We also work in the outpatient clinics, which means we don't have to be present just 24/7 in the ward. We can take care of our patients in the clinics. We also have a very established track which is now upcoming in Singapore, and it's a buzzword called community nursing. We can also work in the community settings, and in that setting, yes, we work as a clinicians, but one of our main role is as a primary healthcare provider to prevent illnesses and also I would say educate our patients on how they can remain healthy. So that's one role very briefly on what nurses do as clinicians. There's a second track which is nurses as educators. Again, it's a fine line, you would say. As a clinicians also, we educate patients. Absolutely true. However, nurse educators, they generally work in educating future nurse leaders, future nursing students, or even fellow nurses who probably are new in the profession. For example, senior nurses educating the junior nurses as preceptors, as mentors, or even coaches nowadays. And as nurse educators, there are different places we can work. For example, as clinicians, we can work in the hospital setting as well as outpatient clinics and community settings. Similarly, as educators, we can work as educators in the hospitals, where we educate novice nurses who join us, provide them on-the-job training under varied titles. For example, preceptors, mentors, clinical instructors, clinical facilitators, clinical educators, or nurse educators. They also can work in academic settings, especially in Singapore. Nursing education is being delivered at two varied places, one in the polytechnics and the second in the university. So as nurse educators, instead of just working in the hospitals, you can also work in institutions such as polytechnics and in the universities, like National University of Singapore. And I also want to reiterate regarding the university education. Nurses, they can work, for example, as an academics in the university, like I say, National University of Singapore, or there's another university where registered nurses can then do their degree. They are those nurses already have a diploma from a polytechnic, and then they go and take degree in a university like SIT, Singapore Institute of Technology in full form. So that's the role of an educator. Role of educator, it has varied and very colorful role. For example, it's not just simply educating the nurses, especially when you work in a polytechnic or in a university. You also play a very important role in developing the curriculum. As examiners, you set exam papers. You also work on not just giving lectures or teaching or tutorials, you also do research so that we can innovate different pedagogies to provide state-of-the-art educational opportunities to our future nursing students, leaders, and clinicians. So that's a little bit on what is the role of a nurse educator. Third one, which is very close to my heart, which is nurse researchers. Now, as nurse researchers, I think that's one role which I feel in Singapore population, people are often very confused. Before I talk about what nurse researchers do, I'm going to share with you a story. which is very close to my heart. I think few years back, I was at an open house. Open house means we were telling public what nurses do, so that parents especially can come and ask us questions, so that parents and the future nurses, which is nursing students, they can make informed decision on whether they want to choose nursing. So I remember this student came, and probably the student knew me and also brought his friend or probably his maybe sibling with the parent, and he called me as, "Hey, Dr. Shefaly," and then started speaking. Then I saw the parents, they have a very amazed look and they were like very confused. And then I stopped and asked, "Is everything okay, ma'am?" And the person said, "I thought I'm speaking to a nurse." Then I said, "Yes, I'm a nurse and a midwife. But this person called you doctor." So for a while, I was just dumbfounded, like, how can I answer this question? But I think I took it as an opportunity. I think it's a beautiful opportunity that I can let people know that nurses can be doctors too. In a way, we are PhD holders, and that's why we earn the title doctor. So coming back to what these PhD holder nurses or nurse researchers, they do. Like I mentioned, if you want to take a real nurse researcher or a scientist role, we must have a PhD degree. I also know of, which is a role which is often people get confused in Singapore context when we say this person is a research nurse. For a research nurse, yes, you need to have a degree with some research background, or you can be taught or trained about research on the job with the OJT training or on the job training. But research nurses' main role remain focus on collecting data on behalf of other research team members, and then probably help them in data entry or analysis and so on and so forth. However, nurse researchers, again, the names are changed interchangeably. Don't get confused with that, but most important thing you need to take note is that if you want to become a nurse researcher / academic in Singapore context, first you must have a PhD. Now, as a PhD holder nurse researchers like myself, what we do? We engage in scholarly activities. What does it mean? That means we plan our research program, we write our research problems, or we write our research proposals, we seek for funds so that our research program can remain established. We train future nurse researchers by having research assistants working with us or training masters and PhD students in their research work. And with that, another role we have is also very importantly disseminating our research findings, which can be via presenting in conferences or engaging in webinars or seminars, and also writing and publishing papers. What's something people don't know about, especially nurse academics, those who work in NUS at least, we are working in a research intensive university. And as a nurse researcher, it doesn't give me any leeway as compared to any other STEM scientist. STEM means people working in science, technology, engineering, and maths. We work and compete with all other scientists in our university to seek funds, to collaborate with multidisciplinary team members at national and international levels to develop our research programs, and then to conduct our research right from the planning, from data collection, analysis to dissemination. So this is something people often get confused, and how nurse researcher differs. No difference. We do the same work like any other STEM researcher. And in addition, the most fulfilling thing of working as a nurse researcher or an academic in NUS is that in addition to developing and maintaining, and then based on our research program, translating our research findings in the clinical practice and providing evidence-based care to our patients, we also engage in education and servicing the community, our university, our departments, or I would say profession by large. And I'm not sure how many of you know, and probably I'll do a video on that I'm one of the President Nurse Award winner from 2021. And one of the reason I got this award, I personally feel, of course, there were many other deserving candidates, but I think one way was that my contributions to research, education, as well as service. That means serving our community. So that's a bit on what nurse researchers do. Again, these are very short snippets, and if you want to know full-fledged, more detailed video on the role of a nurse researcher or an educator, I'm very happy to do that. So moving on from nurse researchers, now I'll talk about what is the role of nurse managers or administrators. They do planning of manpower, they recruit people, they take care of or manage day-to-day ward related things happening in the ward, and also they engage in administrative roles, for example, developing and engaging in policy and planning things around nursing. As nurse managers, I think one of the role is also planning in finance for your department. For example, all the inventory of the things you need day-to-day level in your department, and very, very important, manpower planning. Engaging like who will be coming to what shift and all that stuff. So that's briefly a role of a manager. The last one, which normally people don't talk about, is I would say nurse innovators or nurses who really, I would say, are expert in technology. Especially this is an upcoming field, and I have seen many male nurses flourishing and doing very well in this technology field. And again, these are different tracks. If somebody is thinking about that, wow, there's so many things going on in nursing, some people can get excited. Wow, there's so many new things for me to do, and I have a lot of things to choose from. But it also can daunt some people, because they may feel that I really don't know what is best for me. So again, the best thing, first of all, is making an informed decision, knowing what these different track peoples do, and that's why this video has been created. I will do another video where probably I can share with you that how as a person you can think or choose that what is the track for you. Again, it is no one size fit all, but most importantly, my message through this video is to know what are the different tracks available in Singapore, so that you, when deciding of pursuing that track, you have some basic idea what people under that track they do. So I hope you find this video useful. Please keep watching, and please spread the word, and tell your friends to follow this channel so that we can continue to connect with each other and serve each other. And if you remember from my intro video, I always say the main intent of this video, without any strings attached, is to serve each other from one nurse to another. Remember to stay awesome. Thank you.